Good afternoon and welcome to our Research to Practice webinar series jointly sponsored by the ARC, the American Association on Intellectual and Developmental Disabilities, and the Sibling Leadership Network. This webinar is being recorded and all participants are in listen-only mode. Live captioning is being provided for today's webinar. To access it, please click on the link provided in the chat box. You can also send in questions through the chat box on the webinar console throughout the webinar, and we will moderate a question and answer session towards the end of the presentation. Today's webinar is Strategies for Professionals to Work with Siblings of Individuals with IDD. I'm delighted to introduce Dr. Megan Burke. Megan is a professor of special education at the University of Illinois at Urbana-Champaign. Her research interests include parent advocacy, families of individuals with significant disabilities, and disability policies. Megan's research examines how parents advocate for services for their offspring with disabilities. Additionally, Megan conducts research examining how siblings of individuals with disabilities transition to caretaking roles. We are delighted to have Megan with us today. And with that, I am happy to turn it over to her.
Thanks, Amy. I know that introduction was a bit of a mouthful. I'm excited to be here this afternoon to talk about strategies for professionals to work with siblings of individuals with intellectual or developmental disabilities, or IDD. And I want to note that this presentation is based on a study that we did. I provide the citation at the bottom of the slide, and I can talk more about that as well if people have questions. But it's a study that we did with professionals who work with individuals, siblings of individuals with intellectual and developmental disabilities. So today, I want to spend some time establishing the importance of working with siblings of individuals with intellectual or developmental disabilities. Then I want to talk about real, feasible, tangible ways for siblings to cultivate partnerships with professionals. And finally, I want to talk about ways to overcome barriers for siblings to work with professionals. To provide some context, like I mentioned, this presentation is based on a study that we did with professionals who work with siblings of individuals with disabilities. As a part of that study, we conducted a national web-based survey with parents and siblings of individuals with IDD themselves, and of course, professionals. We had about 3,000 people respond to the survey. Of that, I'm just going to speak to the 300 professionals who responded to that part of the survey today. I also want to say that I'm personally interested in this topic because I'm a sibling myself. In the picture there, you'll see that I'm one of 5 siblings. The sibling that I probably speak the most about is my brother Ryan. Ryan loves Broadway shows. He's currently working 2 jobs. He's 23 years old, and he also has Down syndrome. So that's kind of my personal experience and why I'm interested in this area of research. So I want to lay the foundation about the importance of working with siblings of individuals with IDD. We know that regardless of whether or not a disability is present, siblings have the longest lasting familiar relationship, often outliving their parents. When a disability is present, we know that siblings often take on kind of non-normative, unique roles. Those roles can include caregivers for their brothers and sisters, advocates for their brothers and sisters, support persons for their brothers and sisters, and systems navigators, so individuals who go out and try to secure services for their brothers and sisters with IDD. Given these kind of unique roles, we know that siblings need to collaborate with a lot of different professionals and providers. Unfortunately, based on the sibling research, we know that there are a lot of barriers to cultivating relationships between professionals and siblings. Siblings often report not being involved in service coordination. This could be because when agencies provide family-centered services, they typically think about working with parents, not with siblings. This could also be because siblings themselves acknowledge that they lack knowledge about adult services specifically. They feel like they're not knowledgeable enough to be able to collaborate with professionals. Finally, siblings report feeling discouraged to collaborate with providers, feeling that providers feel more comfortable or more accustomed to collaborating with parents versus siblings, and so siblings sometimes feel a little left out. So now I want to talk about a few ways that professionals in our survey identified that they could collaborate with siblings. So one of the most common suggestions was to invite siblings to different events. Those events could include service plan meetings, like IFSP meetings, IEP meetings, ISP meetings, to talk about the services that their brothers and sisters with IDD are going to receive. Other events could include therapy sessions. And the picture shown on this slide, I have a picture of my brother Ryan with my youngest sister Amy. Amy attended a lot of Ryan's speech therapy sessions growing up, to the point where now she wants to be an SLP when she finishes college. And during that process, I think it illustrated several things. One, it illustrated that as a sibling, Amy had important knowledge that she was able to convey to the SLP during the therapy session. It conveyed to Amy the importance of her role as a sibling, and it also served as a natural support. So Amy was there and able to learn from the SLP and implement and reinforce what the SLP did at home so that Ryan was receiving more services. Siblings could also be involved in evaluations and assessment procedures as well as other events. Again, going back to this picture is from a camp, so siblings could be involved in recreational activities. This picture is a picture of Ryan as a camper, and Amy was a guidance counselor. And siblings could also be involved in boards. A lot of different disability agencies and agencies in general have boards. Usually those boards, especially when they're for individuals with disabilities, are comprised of parents of individuals with disabilities. However, siblings can be an untapped constituency to join those boards. And by inviting siblings, you're acknowledging that they're important members, that they have useful insight, and you're also giving a chance for siblings to start to be involved with an agency and start to provide the foundation for a relationship with the professionals there. The other most common thing that professionals said was to build relationships with siblings. And these kind of sub-bullets may seem like common sense, but it is important to be welcoming to siblings, to listen to them, to be empathetic, and to show that you're an advocate for the sibling voice. With that, though, we know that not all sibling experiences are the same. If you've met one sibling, it doesn't mean that that experience generalizes to other siblings. In our sibling research that we have, we tend to attract a lot of siblings who are very involved with their brothers and sisters with IDD, who are excited and eager to kind of transition to caregiving roles, and who have really positive relationships with their brothers and sisters. However, that is not a representative experience. Not all siblings may feel like that, and the sibling relationship can also change over time. Professionals work with a range of siblings. You can work with siblings who are very excited to be involved and siblings who are not so excited to be involved. And it's important to understand and kind of think about where the sibling is coming from and understanding their context, and then determine how to engage with them. Another way to collaborate with siblings is to offer education and resources. Frequently in the sibling research, we see siblings reporting that they need more education, resources, and information. Probably the most common thing that they ask for is information about the adult service delivery system. Siblings often feel like they don't know enough about adult disability services. While their parents have lived and breathed services since their brother or sister was diagnosed, perhaps, siblings are a little bit newer to it, and it's a very steep learning curve to try to understand different service delivery systems and how to navigate them. By offering trainings about adult services, you're kind of beginning that interaction with siblings and also filling a need that we know they have. Other education and resources can include advocacy, and perhaps for younger children, information about the type of disability of their brother or sister. Another very common area of need for training and resources is future planning. Many siblings report wanting to engage in future planning with their families. We know that this is a really important issue, especially when thinking about siblings transitioning to caregiving roles. Unfortunately, we also know that most families do not engage in future planning, even though it's very important. By offering future planning meetings or future planning events at different agencies, you can start to include not just the sibling, but also the family in its entirety to talk about future planning, which both meets a need, but also starts to cultivate those partnerships with siblings. Finally, providers can provide sibling-specific supports. One of those supports could be a support group. Perhaps the most popular support group that we know of for siblings are called SIB shops. SIB shops were developed by Don Meyer. They're geared for younger siblings. They offer an opportunity for siblings to network with other siblings and share the sibling experience. Other sibling-specific supports can include mentoring opportunities and sibling-specific events. On the right side of the slide, I show a few different examples of agencies that are trying to reach out to siblings that would be good resources to share with siblings. This includes the ARC, SibNet, which is kind of an online platform to connect siblings, and the Sibling Leadership Network, or the SLN. The SLN is kind of the national agency for siblings and sibling supporters. I'll talk a bit more about them in a later slide. But these would be great resources to share with siblings, which then also acknowledges that you understand the importance of siblings, you're trying to connect them with resources, and it starts to build that foundation for a relationship with siblings. Finally, I want to talk about ways to overcome barriers to working with siblings of individuals with IDD. So when we asked about barriers to working with siblings of individuals with IDD, professionals first stated that they like to focus on their positive experiences with siblings. By focusing on these positive experiences that they've had, they felt more reinforced and more likely to try to continue to cultivate these partnerships. Among those positive sibling experiences, professionals reported really enjoying seeing the benefit of the sibling to the individual with IDD. They enjoyed seeing siblings wanting to be involved with their brothers and sisters, seeing siblings have intimate and kind of unique knowledge about their brother and sister, and seeing siblings who are excited to transition to caregiving roles. Professionals also reported enjoying seeing close family relationships. This included close sibling relationships and close parent-child relationships. With this, it's important to note that professionals also recognized that sometimes there were some differences of opinions between parents and siblings. So, for example, professionals reported that parents may be more overprotective, whereas siblings are more excited and more willing to encourage their brother or sister with IDD to engage in different opportunities, to try new things, to develop more independence. Professionals really resonated with that and tended to like to include the sibling perspective to make sure they were able to offer those kinds of opportunities. There are definitely other challenges to developing these types of partnerships. On the left side of the table, I identify a few of the challenges that our professional participants reported, and on the right side, we identify a few ways to overcome those challenges. One of the most common types of challenges was limited access to siblings. It was hard to find siblings, is what professionals said. It's hard to even get in touch with them. Who are they? Getting their contact information. Ways to overcome that could include working with parents to access siblings. Asking the parent, saying, hey, I'd like to include Josie the sister in this meeting. Do you mind giving me her contact information so I can send her a personal invitation? Just that baby step might help to kind of bring the sibling into the situation. Another way to access siblings is through joining sibling organizations. So while this may not unite a professional with the sibling the family they're working with, this may help the professional gain some insight into the sibling experience and identify other ways to engage siblings. Poor sibling attitude was another issue. So this is getting back to that point of professionals saying that they're not just working with siblings who are highly involved and excited to pursue caregiving roles. This gets at some of those siblings have poor relationships with their brothers and sisters for whatever reason. And so with this, we said it's important to consider the context. Everybody is different, and it's also important to be patient because things do change over time. So it is possible that while a sibling's not prepared or ready to be involved at a given time, that may change in the future. Another challenge was systems barriers. And again, this gets at something that I talked about earlier, that service delivery systems are usually more inclined and used to working with parents than siblings. Professionals noted this as well, that it was hard to change the way of thinking about working with families, to shift that thinking from parents to siblings. And we identified a few kind of baby steps to getting towards that. So just by starting to include siblings in the planning or decision-making process or introducing them to the service delivery system, by starting to engage with siblings, you're starting to change the mentality for family to really include the parent and the sibling. Finally, professionals reported that it was difficult to see the caregiving burden that some siblings had. We've seen siblings report that they're juggling multiple caregiving roles. Sometimes siblings are referred to as the club sandwich generation because of their multiple caregiving roles. Specifically, many siblings end up caring for their brothers and sisters with IDD, potentially any children of their own, and also aging parents. That in and of itself can be too much to swallow, which could increase caregiving burden and stress. And so some ways to relieve that burden is to offer interventions and supports like respite care, or even future planning interventions have been demonstrated to alleviate some caregiving burden. So trying to offer some supports to the sibling can be very helpful. Another thing is just to listen to the concerns of siblings. Unlike parents who tend to have a lot of parent support groups and tend to be pretty well connected with one another, sibling support groups and the sibling movement is relatively new. Siblings may not know other siblings in their position. Professionals know both kind of the position the sibling's in as well as their brother or sister with IDD. It would be really helpful to try to reduce caregiving burden if the professional acts as a listening ear for the sibling. Other ways to collaborate with siblings are to be a sibling supporter of the Sibling Leadership Network. As I mentioned earlier, this is the national nonprofit agency for siblings and for sibling supporters. You do not have to be a sibling to join the Sibling Leadership Network. Also, it's free to join, and it provides training and information and resources about sibling issues and sibling needs. So I provide the website there. The SLN also has state chapters in many states across the country, and so through those state chapters, you may also be able to access information that's a little bit more local. So I think I went through that quickly, but I wanted to go through it quickly so that we can spend the majority of our time together opening up a dialogue to talk about some of these issues and chat about other ways to cultivate partnerships between siblings and professionals.
Thank you, Megan. That was super informative. I want to invite folks, if you have any questions or comments for Megan, to please type them into the chat box that is in the lower right-hand corner of your screen. I also want to point out that I have provided a few links to a couple of the organizations and other things that Megan referred to. She mentioned the ARC. There is a Center for Future Planning that I've left a link there. She also mentioned the Sibling Support Group in terms of SIB shops. I've put a link there, and I've also put a link to the Sibling Leadership Network as well there, so that you should be able to access it from the chat box. And again, if you have any questions for Megan, go ahead and type them into the chat box at this time. And as of this moment, we do not have any questions right now. We'll just give folks a few minutes to let some of what you've discussed resonate. I'm wondering if anybody that works for a provider organization or an organization that provides direct services and supports to people with IDD, I wonder if any folks that work for those type of organizations have any comments or want to share a situation or a story that they've encountered. This is also a great time to ask for advice. So feel free to chime in with those types of things as well. One person commented that often many siblings are not included in decisions because parents are taking care of it. And this person is working with many families of older individuals with IDD, and that this type of information is needed so much. So thank you.
Oh, well, great. That's such a nice comment.
Thank you to the person who sent me your private message. Others, if you don't want to share your story, comment, or question publicly, you can send one to me privately. Someone else has asked a question, what are other organizations doing beyond the youth SIB shops to support/educate adult siblings?
Yeah, I mean, beyond SIB shops, SIB shops are pretty much the most popular and international model for sibling support. The Sibling Leadership Network is a leader in trying to provide adult sibling resources and support. So I would say that's probably the primary one that would offer supports like SIB shops to adult siblings. And I would say it's probably the leader in the world to provide that kind of support, but it's also relatively new, so it doesn't have the same kind of established presence as SibShops does. I can't think of another national agency that's really dedicated to siblings or providing support for adult siblings.
I think, Megan, didn't SLN just celebrate their 10-year anniversary?
That's right, yes, they are 10 years old officially.
Fantastic. Keep those questions coming either through the chat box or to me privately. Either way is fine. Okay, here is another one. This person is a parent and a professional in the field, and this person started working on a book for families of what is needed if parents pass away. Navigating the agencies to change everything has been very overwhelming. Once I have the book done, it will be a great resource, but it is a lot of work initially, this person commented.
Yeah, I mean, that is so needed. I'm so glad that you're working on that. You know, something else that I've seen out there to try to help families conduct future planning and try to get things in order for if the sibling's going to transition to a caregiving role is something called a letter of intent. And you can Google lots of different types of letters of intent, but letters of intent are designed to kind of think about what the person currently needs, what supports they need, what you've tried in the past, and it's not just limited to services, but also thinking about the person in general, what do they like to do, where do they like to go, so that could be another thing to think about in helping to ease that transition.
Got another couple questions rolling in, Megan. The next one is, this person wrote, I supported an individual that his mother wanted him to live at home after she died. His sister would tell me that she was going to put him in a residential home as soon as her mother died. How do we begin to help families have conversations about future plans or support the individual to make the choices that they want?
That's such a good question. And, you know, I don't think research-wise we've gotten there yet in thinking about it, but I think the first step is really getting everybody in the same room to talk about, you know, future and where the person with the disability wants to live and what does that look like, you know, because most of the research that we have either presents only the parent perspective or only the sibling perspective, and even less so only the individual with IDD's perspective. But it's really important to have those three people in the same room together to talk about what do they want. I think that's the first step. Now, obviously, it sounds like there's some strong disagreement, so it will probably take multiple meetings to hash that out, but I think the first step is definitely getting everyone all together.
And if I might,
yeah, go ahead.
Shameless plug. One way to facilitate those type of conversations could be through the Build Your Plan tool, which is located on the ARC Center for Future Planning. I've put the link up there again if that is something that might be helpful to you to check out and might help get a conversation started. We've got another comment. This person says, I have found sometimes that siblings sometimes get bound in not wanting to overstep their parents. On the flip side, sometimes guardianship needs to be transferred, and that does not happen through pre-planning, but occurs after the death of the parent. Then the learning curve must transpire immediately.
I agree. I mean, this is a huge, huge issue, and this person's pointing out some common challenges. You know, another challenge is parents not wanting to face their own mortality and not wanting to engage in future planning. And so the sibling doesn't want to say anything, the parent doesn't want to think about it. Something happens where the parent can no longer be the primary caregiver, and then it's a crisis situation. Right, and now you have a person with a disability who's dealing with the death or incapacity of a parent to provide caregiving, and also potentially a traumatic and kind of undiscussed transition to maybe a different placement, to maybe moving in with somebody else, to changing services, whatever the case may be. But all of that could be avoided with future planning and getting everybody in the same room together. This is definitely a common issue that we're seeing, and I think it just makes future planning all the more important.
Folks, you're doing a great job. Keep the questions coming. I've got another one. How do you introduce parents into thinking about including siblings in the meeting?
How do you introduce parents? I mean, I think just talking to them about it, broaching the subject, right? I think you can think about strengths-based ways to include the sibling. So, you know, oh, maybe you want to include, if it was to my mom, you want to include Megan in the meeting. It sounds like Megan has a really close relationship with Ryan. She might want to, you know, be involved. She might have some good ideas about services he could receive or supports that he needs. So I think that's the approach that I would go with in trying to facilitate including the sibling. Something else, too, in my research about parent advocacy, I mean, I tell parents to always bring someone else with them to a meeting. You know, it's a support to the parent to have anyone else there, especially if it's a sibling who knows about the brother or sister with a disability. So you can say, you know, it would probably be a good idea for you to bring someone. Why don't you try bringing Megan to see if she'd be able to go, even if it's just to take notes or whatever. And then at least you have that first step to sibling involvement in the meetings.
Got another couple more comments. Keep them coming. This person wrote, I think families forget just how much knowledge they have about the family member with a developmental disability, as they've been taking care of things for so long. It would be helpful for families to have prompts to have those discussions with extended family members. A good support coordinator could facilitate or begin those conversations in the planning processes with those who receive services.
That's so true. That's a really good point.
Another person wrote or asked, do you have any resources to share for parents who have unreal expectations for their adult children's responsibility when it comes to the care of the sibling? I work with a family where mom and dad live in the same town as their daughter with a disability, and the son lives 500 miles away with his family. Mom wants him directly involved, but he clearly has settled down with a job and family and is not looking to move.
Yeah, I mean, you know, I think that is an issue, and I wish I did. I wish we were at the point where we had a lot more interventions available to kind of facilitate that kind of discussion. But the best I can say is to get them both in a room, even if it's by Skype or by phone with the sibling, to talk about, you know, what is realistic and what does the sibling want to do and what does the person with the disability want, you know, because that's really the first step to trying to understand that and to adjust parent expectations if they need to be adjusted, and also to think about, okay, well, if that's not what's going to happen, what's plan B, you know, and to really work that out and flesh that out within the family.
It's a really difficult conversation to have with a lot of people, Megan, because like you said, a lot of parents don't want to think about their own mortality, and so it's difficult to bring up for certain. I've got another comment here. I have had a wide range of feelings from parents. Some do not want to put, quote, the burden on their other children. Others will give their other children no choice but to take care of their sibling. Very wide range. Another person said, did you want to respond to that?
No, I totally agree. I mean, I think that diversity of parent expectations and how parents are feeling about it, again, is such a huge issue.
Another person said, after 3 years working with a mother and her son, mom agreed to have another son be part of the future planning. The other son knew nothing about services his brother was receiving, and we had a good conversation about future planning.
Good. I'm glad to hear a success story.
Another person commented and has a question. Our system is difficult to understand with all of our alphabet soup descriptors. Those descriptors are different state by state and provider by provider. Is there any movement toward a common language? That's a great question.
That is such a great question. You know, this reminds me of another project that we have where we're educating parents of young adults with disabilities about the adult service delivery system. And we're trying to expand that to include multiple states and looking at, okay, well, what policies are the same across states, what policies are different. And to me, and certainly across states, even if you're talking about the same policy like SSI or SSDI, that's the same across states, but it's still full of acronyms. So you still face that learning curve. But then you have other things like the Medicaid waiver, which is really different across states, and so you do have these state-by-state differences. And I'm not sure that there is any movement towards a common language. I mean, Amy, you would have some insight on that.
It's a problem. I mean, it's certainly a problem related to research across many different projects. You know, like Megan said, that the different waiver programs are called something different in every state, and every state has the option of having different waiver programs. And because of the way that our government is set up and the relationship that the federal government has with the state government, that's their prerogative to do that. There is no, there is no language they need to follow. CMS addressed this a few years back by coming up with a taxonomy, a way of kind of categorizing the services. And then I also was a co-author on an article along with Mary Kay Rizzolo and Carly Friedman some time ago about also creating a taxonomy specific to waiver services. You know, I don't foresee that being carried through at a national level, but hopefully it'll move us closer to a way of categorizing those. But it's a problem. It's difficult. It's a good question. Any other questions, comments, stories, concerns that you would like to share with the group, share with Megan, ask of Megan? Give folks just about another minute or so for any last burning questions. If folks think of something later, Megan, or have this brilliant idea of how to involve siblings, what would you recommend they do? Is it good to, how would they get a hold of you, or how would they pass that idea along to you?
Oh, they can email me. I should have included my email in the PowerPoint. I apologize. My email is Megan, M-E-G-H-A-N, B as in boy, M as in Megan, @illinois.edu. And I'm very responsive by email, and I'm happy to even just put people in touch with agencies or places that might be helpful to them.
And I have put Megan's email address in the chat box.
Thanks.
We have looks like we have a final couple of comments. One is, a person said, I have a family member that mother/guardian died suddenly. The hardest part is that the entire family is grieving, and they have to deal with what to do next with the individual on the waiver. In the future, I will add this to my conversation about future planning. This poor family is more overwhelmed than they needed to be at this point.
Oh, it's such a sad story, but I'm glad you're going to use it, you know, moving forward, because I think that really emphasizes the importance of future planning.
Absolutely. And another comment, it is very hard to simply change an address, let alone change to siblings care, different connections to DHHS, CMH, Medicaid, food assistance, home health, bank, etc. Yeah, there's definitely a lot to think about, and I will again encourage folks, Megan, I hope you don't mind, encourage folks to check out the Build Your Plan tool at the Center for Future Planning. That link was given earlier. The whole center was built around this whole notion that you know, none of us live forever, and we need to have plans in place for when we pass on and the people who depend on us. You know, what's going to happen to them. And I would just encourage folks to check that out, share that resource with any families that you might work with as well. It might be a way to start the dialogue. So Megan, it looks like that we do not have any further questions. Do you have anything else that you would want to add?
No, I hope it was helpful. You know, I'm sorry I ended early. I'm from Chicago.
I don't think anyone's going to be upset about that.
All right.
No one's going to be upset about that. I'm going to go ahead and take the liberty of announcing an upcoming event as well as a new resource. Before I do that, I again want to thank you, Megan, for such an informative presentation. I'm sure folks got a lot about it. I'm getting thank yous from some of the attendees, so thank you very much for taking the time to do this and talk with us today about this issue. I wanted to let folks know that this webinar, along with the previous two, have been recorded and are archived, and the link is on your screen. You can basically just go to the ARC.org, what we do, webinars, and it'll take you to the webinar archives where you can review those past webinars. I also wanted to make folks aware of a new research brief that was co-authored by Dr. Bob Shalak and myself on evidence-based practices, connecting the dots between research and practice. What we tried to do in this brief was to summarize an article that was published in the same volume of the journal that Megan's article was in, and basically to assist providers and other folks to know how the heck do I tell the difference between an evidence-based practice and one that is not, and what does that mean anyway. So hopefully folks will find that helpful. The link is there. And finally, just wanted to make folks aware that the ARC's National Convention is coming up November 2nd through the 4th. It will be in sunny San Diego, California. I believe registration is open, and the link is there. Again, Megan, folks are writing to me in the chat box and saying thank you for a very informational webinar. So Megan, thank you again, and thanks to all of you for joining us today. Please check out all of the sites, the SIB Shop, the Sibling Leadership Network, and the Center for Future Planning, and everyone have a great remainder of your week.